we talk about the tooth setup, how we process these cases and stuff. But you know, Dr. Earl Pound was one of the guys that was really heavy on making these a dental prosthetic, not just plastic and teeth. So what we really like to do is, and actually the way that this developed as far as making sure that the wax is not only mimicking nature in contour but also in color, is really by some of the manufacturers now are providing us. Tedros Candelor has these colored waxes, and you know, it's become a great model for us as a laboratory. It really doesn't take too much longer to colorize the wax up, and a lot of times when the patient or the client sees this, they say, well, hey, can we get this in the final product? And we say, sure, we can, but it kind of stimulates that thought process.
So does that ever worry you? Because when you do it in the wax and they see the colored wax, and when they say we want to see this in the final, does that?
It doesn't. No, I'm glad, because of course it costs more. I mean, you know, there's a lot of work involved, so it's almost kind of an upsell on the finish. And it really doesn't take, once you get proficient at it, it doesn't take too much longer in wax to do those same things. So that's really what I'm showing here. I'll give you an idea of typically how I have it set up at the laboratories. We've got a Redford pot that has 3 wells, so we keep these 3 colors in there. And so essentially the first thing I really start with is once the tooth arrangement is done, we're then going back in and I'm actually removing a lot of the wax on the buckle, and we're doing an additive buildup. So we'll use an electric waxer for that. And the whole idea is that you want to layer a lot of these colors. So I'll actually start with the dark red, and we'll layer up from the more vascular tissue, and it'll be thicker where it's vascular, and it'll kind of thin out where the blanching is. And then we'll actually add our blanching tissue, and there's different ways that we blend it. So it's pretty interesting. One tip that I wanted to just show you is also in that wax pot that I have, sometimes I still feel like we're not getting deep enough reds to really make it look like tissue. So I'll actually add some intensifiers, and most of the companies have these along with their acrylic characterization kits. They're not actually acrylics, they're pigments. So I'll actually use some of the red, and I'll sprinkle it into the wax and mix that up, and it gives you a nice more vascular color. And sometimes if for example the teeth that we're using are a darker shade, a more yellow shade, we'll use like if it's like an A35, I'll use a little yellow in the blanching shade, and it's interesting the effects that you can get from it. So, and I'm just kind of showing some of the cases that we've done and what you can get. As far as carving goes, I think one of the most important things is that you want to keep it cleansable. So we don't want to be digging into a wax up. For example, this is one of the tools that the SmileLine has. A great tool because you have an angle, and I'm always trying to come in as I carve at a 45-degree angle. And this way you're not, you know, we've seen people waxing where they're carving in at this angle, and you're creating a trap. You're creating a space for debris to collect. So always at a 45-degree angle is how I'm carving, and this is going to deflect the debris. Once we've got everything built up positively in wax, I'll go back in, we'll carve. I'll also take an instrument that's like a spoon similar to this, and you know, once you've done that, even though you've done that 45 degree, you've still got a sharp edge when you come out onto the outside of the wax up. So I'll go in and I'll literally just break the edge. I'll just kind of run down a bunch of strokes, just break that edge, and it'll keep it nice and smooth, makes it look like natural. We couldn't have an open flame here, but that's essentially how I would then go back in and flame that.
So you do not use an electronic waxer?
Yeah, actually, when I'm doing the buildup, I'll use an electric waxer, and I'll just dip into the Redford pot with the darker wax, and I'll just add it in with that.
Setting your teeth, you still use the tool?
I still use the tool and the flame, yeah. Yeah, and I know Jim mentioned also some of the issues with the electric waxer. You've got to be careful, of course, because you're not going to get the wax as hot, so you've got to be careful not to trap any bubbles in there, any air, or anything like that. But that's some of the effects that you can get.
Very cool.
Yeah. And so the other important thing that I've found is you've got to, the really follows the contour. So with tissue, if you don't have the contour in there, everything appears very flat. If you're using multiple colors and you're just putting them where you know they need to be, but you don't have any contour, it looks bizarre. I mean, it looks really not good. Yeah, it's all just laying on the surface. So you want to make sure that you're also doing your contouring properly, and it's kind of something that we do additively. So as we use the colors, that's how we're doing it. The other thing is stippling. So we were over at one of the other groups, and they were talking even in ceramics. Apparently, this is also an issue where if you're trying to achieve some kind of orange peel effect or stippling, some people are using like a toothbrush and putting in there. So what are some of the issues that you can right off the bat see with that?
Black.
Yeah, I mean it's going to trap, right? So it's a big problem. Anytime we put anything negative into what we're doing in the final. Yeah. So I was in Germany last year, and a technician showed me a technique whereby I'm trying to think. Actually, I'm just using like a spatula, and what I'll do is I'll cover the teeth with maybe a paper towel, and we'll heat the wax up pretty good over an open flame, and literally like blow it onto the wax in just a really quick, and you get this positive stippling effect. And actually, most of the stuff that you're seeing in my photography is all this positive stippling buildup. I tell you, it's much easier to keep clean, easier to polish. You know, that whole stippling in the negative is not a big deal. So I mean, that's some of just the basics that I'm using here. I'm also using this tool here, and you'll see some of the kind of striations of the tissue as we get into the more vascular. And that's, again, it's just using this and that motion where you're getting in like that. But I mean, you know, using these colored waxes, I mean, again, we're getting we're giving the patient a prosthetic rather than a denture. So it really works very well. I'm trying to think if there's anything else I can touch on before I kind of move in. Is there any other questions on just the wax of itself? I don't know if all y'all gathered just my use of the pigments and stuff. I mean, it makes a big difference. It's really pretty interesting. And the stippling effect is it's great. Now in the finish, that's always an issue too. When I'm doing it positively like this, it makes a big difference. And what I'll do, you know, like we're replicating a lot of rugae in our dentures as well. You know, a little more difficult to polish. What I'm using is some Robinson brushes and triple as a polish. And I mean, I go at it for a while. It takes a little while, but you're trying to achieve this cleansability, but you also want it to look like it's tissue. So it can be a challenge, but that's essentially how I'm doing it.
I used to polish dentures, and with a rag wheel, you just take it right out. I mean, you can't polish it.
Right. Yeah, and I'm glad you. So the other thing I do in addition to the brush is we'll do. I have a single row brush on the polishing on the lathe, and so we use pumice kind of at a low speed, and it really allows us to get into all the crevices that are there, be able to polish them enough that it's going to be cleansable. And we've had, for a good number of years now in the mouth, no issues as far as it trapping anything. And again, I like to characterize mainly in acrylic because with some of the composites now, if it's a temporary situation, that's great. But I've found that we've done some of the composite, and we're just getting a lot more black instead of attractive to the composite. It tends to stick to it. So those are some of the issues that we have.
Right there. I appreciate that. When you're doing this characterization of the game, right? You ever hear anything back from patients that maybe they don't like that? Because most of these denture patients have had totally flat, completely unremarkable prosthesis for 20 years, and now all of a sudden they've got this hypertexture.
Well, again, that's we're here for collaboration. Again, that's a huge thing that we need to talk about with our client on a case-by-case basis. If it's a patient that's had an immediate denture a long time ago, like you said, they may need that. And so I try to discuss that. I try to approach that before we get to this point. I'll always put in the wax. If the client is kind of saying, well, I don't know. See how the patient feels. I'll say, okay, let's do it in the wax up. See how the patient feels about it. If they feel it's something they feel they can't do it, just let it out. So that's basically how we're handling it. I did want to touch on too. I know this demo was supposed to be mainly about the wax ups, but I've been doing a fair number of telescopic devices, so implants and tooth work. So I'm gonna just show you a couple things. Actually, if you guys want to just take a look at the wax, so I've been doing quite a few of these telescopic cases over implants and tooth work. Essentially, it's a much bigger thing in Germany than it is in the U.S., and I think it has to do with the nature of the precision. So basically what we're looking at is kind of a new way to hold an implant retained dentures. It's a 0-degree primary abutment. It's dead zero, so it's as precise as you can get. We do a secondary galvano coping, and that gets picked up inside of the prosthetic. So you can go palatless implant awareness, which is pretty cool. As opposed to like some of the resilient attachments, or even some of them that end up being somewhat rigid. The tissue is still taking quite a bit of trauma, and we've been seeing some of these cases not do so well long term. So I've really gotten on this kick, and I've now just really gotten to absorb it. But to give you an idea, this is kind of a crude example, but this would be kind of an example of.
We got it on film, Lucas.
Even more crude now.
But a good example of primary telescopes and how that works. And then now in this case, we have a thermal form top of that, but in most cases we do galvano.